thinking specifically about children who are on the autistic spectrum. So it's estimated that between 40 and 80% of children with autistic spectrum conditions have sleep difficulties, and that compares with 25 to 40% in the typically developing population. So it's about twice as much incidence rate. And by sleep difficulties, we mean taking a while to get to sleep, sleep fragmentation, so just lower quality of sleep, difficulties with nighttime behaviors, perhaps, a shorter total sleep time, and circadian rhythm sleep difficulties. So delayed sleep phase can happen as well. Children who are on the autistic spectrum, on average, sleep for about half an hour shorter times than typically developing children. And there's various reasons why that might be, but we know anxiety can impact on sleep, and we know that children who are on the spectrum might find situations more anxiety provoking. So they might just be living with a kind of higher level of general anxiety day to day, and that might be to do with predictability of what's going to happen. So trying to communicate as clearly as possible what's going to happen at bedtime and keeping it as consistent as possible realistically might help with that. Other strategies to manage anxiety include having a chat. So if your child is verbal, having a chat about the things that might be on their mind, maybe doing a bit of problem solving and kind of scheduling that in every night, so it's an option to talk about it. Other children might prefer to write down their worries and put them in a worry monster or something like that, and then you can either get them out in the morning or just throw them in the bin, whatever works for your child. Mindfulness approaches can be helpful. So mindfulness doesn't have to be a big exercise. It can just be noticing what color the leaves are on a tree, or feeling the sensation of the water in the bath or the shower. So it doesn't have to be an elaborate exercise. And breathing exercises can help to calm the body down. Exercise wise, we think exercise is really good. So we would recommend exercising for 20 to 30 minutes, at least 3 days a week, but whatever works for your child, really. So we'd hope the exercise would kind of get the heart pumping. So exercise is brilliant. If it's too close to bed, for some people, that can just keep them awake because it's quite physiologically stimulating. So we would say try and keep a few hours between exercise and bed just to see if that helps. But definitely running people's kind of batteries down during the day through exercise, play, excitement, that's all good. And then a pre-bed wind down, we would say try and start it about 60 to 90 minutes before bed. So at that point, it would be something like winding down, slowing down your activity, maybe putting on pajamas, using the loo, washing your hands, brushing your teeth, drinking water, and then a story, and then go to bed and sleep. And sometimes that could be presented as a visual chart. And we found that actually putting the visual stimuli, the pictograms on Velcro, so that the young person can actually rearrange the icons and say, actually, I want to brush my teeth and then have story time, or I want story time and then to brush my teeth, whatever works for them. If they feel more in control of it, then that's probably going to be helpful. So again, thinking about what works for your child. So it might be pictures, it might be words, it might be the actual items. So having some shampoo, a hairbrush, and a CD just literally stuck on with Velcro onto the planner, that might make more sense to the young person and might make it more fun.